Welcome back. Researchers say in less than 1 minute, your heart can pump blood to every cell in your body. But when something goes wrong, it's critical that you get the proper treatment. And
Dr. Van Crisco is part of the team at First Coast Heart and Vascular Center. He has more on their new treatments and how they can help you maintain a healthy heart.
Hello,
Doc. Thank you for being here. We appreciate it. So you're an interventional cardiologist. How is that different from a general cardiologist?
Interventional cardiologists provide diagnostic procedures and therapeutic procedures minimally invasively, mostly through catheters. So a general cardiologist might make the diagnosis and perform a treatment plan, but the interventional cardiologist has specific training and expertise in things like angioplasties and stenting, percutaneous valves, management of structural heart disease, things like that.
And when it comes to the heart, I mean, any kind of doctor, you want to make sure that you're going to somebody who's very accredited, knows what they're doing. You got quite a background too, don't you?
Well, I certainly am board certified in interventional cardiology, general cardiology, and even internal medicine. I'm originally from North Carolina. I trained, I went to undergraduate at Wake Forest University there in Winston-Salem, and then UNC Chapel Hill Medical School, University of Michigan in Ann Arbor for internal medicine training, and then Emory, it's where I trained in cardiology and interventional cardiology in Atlanta.
Well, I won't hold that Michigan thing against you, being an Ohio State fan, and also a Gator, just want to say that too. Tell us a little bit about your practice and what hospitals you cover, and yeah.
I was recruited down here by the guys at First Coast Heart and Vascular Center, the excellent physicians there, and I am one of 6 docs in the practice. I perform procedures mostly at Memorial Hospital, but others as well. We have offices in all 3 major counties in the Jacksonville area. At Duval County, we cover Memorial, and our office is right next door to Memorial Hospital. In Clay County, we have an office on Fleming Island near Orange Park, and then St. Johns County, an office near Flagler Hospital. We cover that hospital as well.
So pretty much wherever you are in Jacksonville, we can come and see you.
We're here to meet the needs of the patients of Northeast Florida.
So let's talk about some of the new advancements that you guys have and new treatments that you have for interventional, I can't even say that right. And how you say it for me?
Interventional cardiology.
Thank you very much.
Yeah. One of the reasons I was brought down here primarily is I have a long experience with vascular access that's sort of different than most other docs. Traditionally, heart catheterization, you need to get to an artery and then guide your way to the heart to perform diagnostic and therapeutic procedures. Traditionally, the access has been from the femoral artery in the groin. I do a lot of radial access in the wrist. This was initially done by the Europeans in the 70s and 80s, and then I've been doing it for about 15 years, ever since I left training at Emory. Access of the artery in the wrist is associated with fewer vascular access complications and earlier mobility for patients.
So heart procedures can vary really from something that's minimally invasive all the way to open heart surgery. If a patient comes in, when could they, or how do they know which kind of procedure they can expect? I'm sure it is based on what they're diagnosed with.
Right. It's really up to the experience of the cardiologist and the patient situation, obviously. Not everybody's a candidate for every procedure, but you know, if the physician is experienced in those techniques and vascular access from the radial position, patients can expect fewer vascular access complications, fewer bleeding complications, earlier ambulation. And one of the things about that is we've been able to reduce the complication rate so low that we can do same-day discharge angioplasty and stenting now, and we do that at Memorial Hospital on a regular basis. What you're talking about is coming in, getting a heart catheterization from the wrist artery, making the diagnosis, discussing with the patient, getting a balloon angioplasty and a stent procedure, and actually going home the same day.
The same day. Now, is this what this is right here?
Actually, this is a percutaneous aortic valve implant, and this also is one of the latest technologies we have available. Historically, if you need an aortic valve replacement, you were left with open heart surgery as your main option. We have a technology that allows this particular valve to be crimped on a balloon, inserted through a catheter, guided to the heart, deployed really where your old valve was, and it seats well and becomes the permanent implant instead of having open chest surgery.
Wow, so now instead of cutting it open and going in and having to do that, you come up through the thigh and...
That's correct.
That's amazing.
It really is quite amazing, and you know, the technology has allowed us to offer these minimally invasive therapeutic strategies for patients now on a daily basis.
Which is incredible. I mean, it's just technology. And have you seen this just evolving more recently where we're seeing these new advancements in technology? I mean, it just seems like every day that something else is coming out that's making the lives of patients just much easier as far as dealing with these.
You know, unfortunately, heart disease is a major problem
Sure.
in the Western world, and so we have a lot of patients in need, and that really drives the physician and the industry to innovate, to come up with strategies that reduce the risk of complications for patients. And that's what it's all about.
All right.
From
Well,
talking
thank
a
you.
little bit, well, I just want to ask, from talking a little bit earlier, you seem very passionate about what you do. What is it that most drives you in this field?
You know, taking care of patients is really the primary thing. And when it comes down to it, having an understanding of the medical literature and how it applies to that particular patient that you're seeing, and then actually being able to communicate that to the patient on their level so they can make an informed decision. That's what it's really all about for me. You know, everybody's a patient ultimately at some time in their life, and being able to, you know, connect with them, understand their problem, and offer the best strategy for them. And, you know, there are going to be many strategies of care for patients. If you're told your option's really only surgery, it's okay to seek a second opinion if you have time to do that. And certainly we're available to the patients of Northeast Florida for second opinions if you're told your only option is surgery, that type of thing.
All
Thank
right.
you.
Well, thanks so much for being here. We want to thank, of course, First Coast Heart and Vascular Center for sponsoring this segment. If you want to learn more about the treatments or schedule an appointment, you can visit firstcoastheart.com. You can also go to their telephone number, which is 423-0010. I'm going to give that to you one more time just to make sure we get it correctly. It's 904-423-0010.
The team of specialists want to remind you that if you are told that your only option is open heart surgery, call for a second opinion.